Welcome to today's session on Informed Consent, Patient Rights, and Ethical Approval. I'm your instructor, and this lesson is presented by Jeet Ghosh, an esteemed master trainer and healthcare author. Let's start with a simple understanding. Informed consent, patient rights, and ethical approval form the backbone of ethical medical practice and research. These concepts ensure that we, as healthcare providers or researchers, uphold the core principles of autonomy, beneficence, and justice. Informed consent ensures a patient's right to make decisions about their own body. Patient rights emphasize dignity, respect, and access to information. Ethical approval makes sure research is conducted responsibly. Together, they foster trust, transparency, and integrity in healthcare. Section 1. What is informed consent? Informed consent is much more than just getting a signature on a form. It's a process of communication. As healthcare professionals, it's our duty to ensure that patients are fully aware of what a treatment or procedure entails. This includes explaining the benefits, risks, and alternatives. Only after this understanding can a patient voluntarily agree, or disagree, with the proposed care or participation in a study. This promotes ethical integrity and patient empowerment. Section 2. Key elements of informed consent. There are 5 critical elements to informed consent. Disclosure. The patient must be given all the relevant information in a way they can understand. Comprehension. It's not enough to give information. We must make sure the patient actually understands it. Voluntariness. The choice must be free from pressure or coercion. Competence. The patient must be mentally capable of making the decision. Agreement. Finally, they must explicitly consent to the procedure or study. Each of these elements ensures the process is truly ethical and patient-centered. Section 3. Legal and ethical importance of informed consent. Informed consent is not just an ethical formality, it's a legal requirement. When done properly, it protects patients' rights to make decisions about their bodies. It also builds trust between healthcare providers and patients. Legally, if informed consent is not obtained, the provider may face legal consequences. Ethically, it could result in a loss of credibility and harm to the patient. So, it safeguards both the patient and the provider. Section 4. Types of informed consent. There are several types of informed consent. Written consent, common for surgeries or research, where a signed document is essential. Verbal consent, often used in routine procedures, the patient agrees after an explanation. Implied consent, for instance, when a patient holds out their arm for an injection, consent is assumed. Digital consent, with technology, patients can now give consent via electronic platforms, especially in telemedicine. Each type is suited for different contexts, but all aim to uphold patient autonomy. Section 5. Challenges in obtaining informed consent. Despite its importance, obtaining informed consent isn't always easy. Some common challenges include language barriers. Patients may not speak the same language or have low literacy. Cultural influences. These may shape how decisions are made, such as family-centered choices. Cognitive impairments. Patients may struggle to understand due to age, illness, or disability. Time pressures, especially in emergencies, detailed discussions may not be possible. These factors can hinder true informed decision-making. Solutions to informed consent challenges. To overcome these challenges, we must adopt effective solutions. Use clear and simple language, avoid medical jargon. Utilize visual aids and interpreters for better understanding. Include family members or legal guardians if the patient is vulnerable. Allocate enough time for questions and clarification. These steps make the consent process more inclusive and ethical. Section 7. Understanding patient rights. Patients have rights that must be respected in every interaction. These include the right to informed consent before any medical procedure, the right to privacy and confidentiality of their information, the right to access their medical records and seek second opinions, the right to refuse treatment or withdraw from studies, the right to be treated with dignity and respect. Knowing and upholding these rights is essential for ethical and compassionate care. Section 8. Patient rights in clinical research. In clinical research, patient rights become even more critical. Participants have the right to join or leave the study at any time. Be fully informed about potential risks and benefits. Receive compensation if they are harmed. have their data protected and kept confidential. Researchers must prioritize these rights to maintain trust and ethical integrity in studies. Section 9 Ethical Principles in Healthcare and Research. There are 4 foundational ethical principles in healthcare. Autonomy, respecting the patient's choices. Beneficence, doing what is best for the patient. Non-maleficence, do no harm. Justice, ensuring fairness and equal treatment for all. These principles guide all ethical decisions, from clinical practice to complex research studies. Section 10 What is ethical approval? Before conducting research involving humans, ethical approval must be obtained. This ensures the study follows established ethical standards and protects participants from harm. Ethical review is done by an institutional review board, IRB, or ethics committee. Without their approval, research cannot legally proceed. Section 11 Process of obtaining ethical approval. Here's how ethical approval is typically obtained. Submit a detailed research proposal to the ethics committee. Include information about your methodology, how participants will be selected, and how risks will be managed. Show that the study adheres to ethical and legal guidelines. Wait for the committee to review and approve the project. Only after this can you begin the study, ensuring that human dignity is protected throughout. Section 12 Role of IRBs and Ethics Committees. IRBs and ethics committees play a key role in ensuring research is ethical. They review proposals for compliance, protect the welfare and rights of participants, monitor studies as they progress, ensure alignment with international codes like the Helsinki Declaration. Their oversight is critical to responsible research. Section 13 Ethical Challenges in Research and Healthcare. Even with safeguards, challenges arise. Balancing autonomy with medical advice. Obtaining consent from vulnerable populations. Managing conflicts of interest in clinical trials. Ensuring confidentiality in a digital age. Each situation demands careful ethical consideration and transparency. Section 14 Addressing Ethical Issues in Healthcare. How can we address these issues? Create and enforce clear policies. Encourage open discussions about ethics. Strengthen legal protections for patients. Promote accountability and transparency in decisions. Ethics should not just be a topic we learn but a practice we live by. Section 15 Case Study, Ethical Dilemmas in Clinical Practice. Let's look at a real-world case. A terminally ill patient refuses life-saving treatment. This raises a conflict between respecting their autonomy and the doctor's duty of beneficence. What's the resolution? The best approach is to honor the patient's decision while offering palliative care and emotional support. This ensures ethical balance and patient dignity. Section 16 Future Trends in Ethical Healthcare Practices. The future of ethics in healthcare is evolving. Some emerging trends include use of AI and digital consent tools, developing stronger global bioethics policies, expanding patient advocacy and shared decision-making, prioritizing data privacy in the digital and telemedicine space. As technology changes, so must our ethical frameworks. Let's wrap up. Informed consent empowers patients and builds trust. Patient rights must be protected in care and research. Ethical approval ensures the safety and integrity of research. Ethics in healthcare must evolve alongside science and society. These principles are the heart of compassionate, professional, and lawful healthcare. Thank you for learning this lesson. Now let's move to next chapter.